Hello, this is Dr. Gay from First Look MRI, and this is a 71-year-old male who complains of ankle pain, and he has a tear of one of his medial tendons called the posterior tibial tendon, and he also has what looks to be a tear of a lateral tendon, but this is just a pseudo tear. So I'm going to show a true tear of the medial side and then a pseudo tear of the lateral side related to a phenomenon we call magic angle phenomenon. So this is a view called an axial view. We can see the medial tendons, 1, 2, 3 medial tendons here coming down. And this tendon, the posterior tibial tendon, as it comes down, 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 down to the foot, it will attach to this boomerang-shaped bone, the navicular bone. It attaches right here. And this is the posterior tibial tendon. We should see a nice dark tendon coming to the bone, but instead it's ill-defined and foggy. So this is partially torn from the navicular insertion. On this view, we see the posterior tibial tendon coming down, ill-defined, and there's a little vertical band of brightness right where it is supposed to attach to the bone. So this is a partial tear. It's stripped off partially, and this will cause medial-sided pain, and also it'll cause the plantar arch to collapse, and this patient does have a flat foot deformity related to that posterior tibial tendon tear. Now on the outside, incidentally, we see that the patient has an apparent tear of one of these tendons, and this is just an artifact, but it's good to know about it. It's called magic angle phenomenon. So this is the peroneus longus tendon, and in front is the peroneus brevis tendon. These are the two lateral ankle ligaments. We see them on this view, 1, 2. We're going to go down, down. We see two of them still. In this cut, one of them disappears, so that peroneus brevis just completely disappears. Looks like it's gone, and this is the peroneus longus. So if we didn't know better, we'd say the peroneus brevis tendon is completely torn because it disappears, but again, this is just a pseudo tear or an artifact called magic angle phenomenon. And let me go over to this view. On this view, we see the fibula, so we know we're on the lateral side. The muscles here turn into the tendons. Peroneus longus and brevis tendons kind of together here, but we see them separate. The one in front is the peroneus brevis tendon, and right here it just disappears. We should see a dark line like a cable going all the way from here down to the attachment on the base of this fifth metatarsal, but instead we see just absence. So this is called magic angle phenomenon, and in this patient the magnetic field is this direction. And magic angle phenomena happens when a tendon is oriented approximately 55 degrees or slightly less than 55 degrees to the magnetic field. And this is about 50 degrees, so very close to that magic angle of 55 degrees, and it will just disappear. And same thing with the peroneus longus. It comes over here and just disappears. So to stop this artifact, we will sometimes put the toes down, and when we put the toes down, then instead of having a right angle, this angle will be less, and the tendons will come more vertically or be more vertically oriented, and they won't get that magic angle phenomenon. So we typically do ours with toes pointed down to avoid this artifact called magic angle. And that's it. Thank you very much.